and welcome back to this segment on our channel called Answering Your Most Google Medical Questions by Heidi Gastro, and today's video is a very fascinating and interesting one, so let's get started. So in today's video, we'll explore the question of how the COVID-19 pandemic positively prevented other respiratory tract infection outbreaks in the last few months. So acute respiratory infections, also commonly known as ARIs, are a group of diseases which include pneumonia, influenza, and the respiratory syncytial virus, or RSV, and may be caused by a variety of different bacteria and viral species. ARIs are responsible for approximately 4.25 million deaths each year and are the top killer in low and middle income countries. So since January 2020, the SARS-CoV-2 outbreak has generated much fear and countermeasures to curb the spread of this rampant respiratory virus. This has largely been fueled by the tremendously extensive reporting of COVID-19 associated deaths worldwide. So globally, as of the 30th of June 2021, there have been 181,521,067 confirmed cases of COVID-19, including 3,937,437 deaths, which were reported by the World Health Organization. And as of yesterday, which was the 30th of June 2021, a total of 2.9 billion vaccine doses have been administered. So to curb the coronavirus disease pandemic, many countries around the world have implemented strong preventative measures, such as the mandatory use of face masks, frequent hand washing or sanitizing, social distancing, and the closing of schools and public recreational facilities. But these interventions have not only affected the incidence of COVID-19, but have also had a great impact on decreasing the transmission of other respiratory infectious diseases that are also proven to be preventable through good social hygiene. So a recent study held in South Korea aimed to determine how the COVID-19 management policy has influenced the positive rates of other respiratory viruses was carried out. Samples were collected from local patients and were tested for 8 target respiratory tract viruses, including adenoviruses, human bacuviruses, human coronaviruses, human metapneumoviruses, human rhinoviruses, influenza viruses, parainfluenza viruses, and the respiratory syncytial viruses, all using the real-time reverse transcription polymerase chain reaction, or the RT-PCR testing process. The study compared the amount of active cases of respiratory infections from weeks 1 to 18 per year for the past 10 years. And the shocking data revealed that the overall positive rate of the respiratory viral infections was just 38.7% in 2020, whilst averaging an astonishing 62% in the years 2010 to 2019. So the mean positive rate of the past 10 years was the highest for the influenza virus, followed by human rhinovirus, adenovirus, human metapneumovirus, human coronavirus, respiratory syncytial virus, parainfluenza virus, and the human bacuvirus, while that for 2020 was the highest for influenza virus, followed by adenovirus, human rhinovirus, human coronavirus, respiratory syncytial virus, human metapneumovirus, human bacuvirus, and the parainfluenza virus. But it's apparent by this data that the overall positive rate of the respiratory viruses decreased by an astonishing 32.6% in 2020 compared to the mean positive rate in the past 10 years. So because of the preventative measures that have become part of our daily lives, the overall positive rate of the respiratory viruses decreased by 32.6% in 2020 compared to the mean positive rate in the past 10 years. In particular, human metapneumoviruses, human rhinoviruses, influenza viruses, and parainfluenza viruses showed significant decreases in the same calendar weeks. And so the basis of the study has proven that personal hygiene practices such as regularly washing your hands and wearing your masks can block the spread of waterborne and respiratory infections. The study was able to reaffirm the importance of disease prevention interventions, which revealed a decrease in the incidence of respiratory viral infections tremendously. So even if the COVID-19 pandemic does end soon, continuous promotional efforts to raise awareness regarding the benefits of preventative measures will be required going forward because their benefits are truly astounding. And that brings us to the end of this video. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you would like to help us make better videos and content, you can also donate to us via PayPal. Take care and thanks for joining me today as I explored how the COVID-19 pandemic positively prevented at the respiratory tract infection outbreaks in the last few months.